welcome to the deep dive. Today we're getting into something pretty important, a condition called right-sided congestive heart failure, R-CHF for short.
Right. It's about, well, an imbalance in how the heart works.
Exactly. Think of the heart having two sides working together. But what happens when that right side, well, when it starts to struggle? That's what we're digging into.
Yep. And we've got some detailed source material on this. Our plan is really to pull out the key info for you.
To give you a clear picture of R-CHF, basically, even if you're totally new to this kind of medical stuff.
Think of it as a key problem in how blood circulates, a sort of bottleneck.
So just to start simply, what is right-sided congestive heart failure? What's happening?
In basic terms, the right side of the heart just isn't pumping blood forward effectively, towards the lungs where it needs to go.
And so?
So you get a backup, blood starts pooling in the body's veins. Imagine traffic backing up on a highway because of a block ahead.
Okay, I get that. And this backup, it doesn't just affect the heart, right? It sounds like it would cause wider problems.
Yeah, absolutely. That's what makes it, well, clinically interesting. You see these ripple effects. A problem in the right heart showing up in all sorts of ways across the body.
And our source gets into all the causes, the signs, how it's diagnosed, and the treatments. So let's get started. Maybe first, the mechanics. What's physically happening inside?
Okay. So the core definition is the right heart failing to pump enough blood or failing to stop blood pooling in the veins.
Right.
And the process behind that, well, you get high pressure building up in those veins. This pressure forces fluid out.
Out of the blood vessels.
Yeah, exactly. Like squeezing a wet sponge. The fluid leaks into spaces it shouldn't be in the chest cavity. That's pleural effusion.
Okay.
The abdomen, that's ascites. Even around the heart itself, pericardial effusion. Or just into the body tissues, the interstitium.
So it's like the plumbing system is overflowing and the fluid is seeping out into places it shouldn't be.
That's a pretty good analogy, yeah. And when the amount of this leaking fluid is more than the body's drainage system, the lymphatics can handle.
That's when you see the actual problems.
That's when you see the clinical signs, like the fluid in the chest, the swollen belly, maybe fluid around the heart, or swollen tissues, what we call peripheral edema.
Okay.
Though it's interesting that peripheral edema, the swollen limbs, it's actually pretty rare in dogs and cats with R-CHF.
Huh.
Yeah.
Okay. So the main takeaway here is that R-CHF isn't just a heart issue in isolation. It causes these very real physical effects elsewhere because of the fluid backup. Shows how connected things are.
Definitely. And the source points out all organ systems can potentially be affected.
How so?
Two main ways, really. Either they're not getting enough oxygenated blood delivered because the pump isn't working well,
Makes sense.
or they're directly affected by the congestion, the backup of blood in the veins draining them. It really underlines the systemic nature of it all.
That initial problem in the right heart really does domino through the body.
It really can.
So we understand what it does. Let's talk about why. What actually causes the right side of the heart to struggle like this?
Yeah, the causes are varied. It helps to kind of group them. First, you've got actual pump failure. The heart muscle itself is weak or damaged.
Like what?
Things like idiopathic dilated cardiomyopathy, where the muscle weakens for no obvious reason, or ARVC, arrhythmogenic right ventricular cardiomyopathy.
It's a mouthful.
It is, but it's interesting. It seems to have a genetic link, particularly in boxer dogs. Then in cats, you see things like hypertrophic or restrictive cardiomyopathy, different ways the muscle is affected. Also, infections like trypanosomiasis, certain drug toxicities like from doxorubicin, even chronic hyperthyroidism can lead to pump failure.
Wow. Okay, so a whole range of things can directly weaken the muscle. What's another way the right heart gets into trouble?
Second category, volume overload. This is where the right ventricle is just getting too much blood dumped into it, making it work way harder.
How does that happen?
Common cause is chronic AV valve insufficiency, leaky valves between the heart chambers, often from something called endocardiosis, or maybe a birth defect like tricuspid valve dysplasia.
Okay, so either the pump's weak or it's being swamped with too much blood. What else?
Third, there's pressure overload. Here, the right ventricle has to push against abnormally high pressure downstream, usually in the pulmonary artery heading to the lungs.
Like pushing against a closed door.
Sort of, yeah. Classic example is heartworm disease. The worms literally block things up in the heart and lungs, raising the pressure.
Nasty.
Definitely. Other causes are things like chronic lung disease causing pulmonary hypertension, blood clots in the lungs, pulmonary thromboembolism.
Okay.
Pulmonic stenosis, which is a narrowing of the valve leaving the right ventricle. Complex congenital problems like tetralogy of Fallot, even tumors in the right ventricle, or primary pulmonary hypertension.
So lots of ways resistance can build up.
Exactly. It's all about the resistance it's pumping against.
Got it. What's next?
Category 4 is impediment to filling. Something physically stops the right ventricle from filling up properly between beats.
How could that happen?
The big one is pericardial effusion fluid building up in the sac around the heart. If there's enough fluid, it can squeeze the heart, that's called tamponade, and stop it filling. Other things are like constrictive pericarditis, where the sac itself gets stiff, or masses, tumors in the right atrium or the big veins leading to it, or narrowing of the tricuspid valve, tricuspid stenosis, and a rare thing called cor triatriatum dexter.
So it's not just about pumping out, but also getting the blood in.
Precisely. Can't pump what you don't receive.
Makes sense. Anything else? Can the heart's rhythm itself cause R-CHF?
Yes, that's the last category. Rhythm disturbances. Certain arrhythmias. Specifically, really slow heart rates, like complete AV block, or really fast, sustained ones, usually supraventricular tachycardias. Either extreme can impair how effectively the heart works over time.
That's quite a list of potential causes. Really shows how many things can go wrong with that right side. So how does this actually look? What signs might you see in an animal?
Well, the signs can definitely vary. Depends on the cause, the species. But there are some common things owners might notice or vets might find.
Like what sort of things might an owner report?
They might say their pet seems weak or tired, just lethargic, maybe can't exercise like they used to. Or they might notice their belly seems swollen, distended, sometimes difficulty breathing, either faster breathing or more effortful breathing.
And what about during a vet's physical exam? What are the clues?
Key things we look for are jugular venous distension. Those neck veins look really full, maybe bulging. Sometimes you can see a pulse in them, or elicit a hepatojugular reflex pressing on the belly makes the neck veins bulge more.
Interesting.
Ascites, the belly fluid, very common in dogs with R-CHF, much less common in cats.
The distinction.
Yeah, and interestingly, in dogs, finding fluid in the chest without ascites and an enlarged liver makes R-CHF less likely. Same for cats, finding ascites without pleural effusion is less typical for R-CHF. But small amounts of pericardial fluid around the heart without causing that tamponade compression, that can be relatively common in cats.
What else might you find?
Maybe an enlarged liver, hepatomegaly, possibly a heart murmur, depending on the cause, like a whooshing sound if the tricuspid valve is leaky, or maybe an ejection murmur if there's pulmonic stenosis. Heart sounds might be muffled, quieter if there's a lot of fluid in the chest or around the heart. We might feel weaker pulses in the back legs, and like the owner might notice, fast, shallow breathing if there's significant pleural effusion or ascites.
And you mentioned peripheral edema, the swollen limbs, is rare.
Yeah, not something we see often in dogs or cats with R-CHF.
So putting together the history, the exam findings like jugular distension and ascites in dogs, that points you towards R-CHF. But how do you confirm it and rule out other things?
That's crucial. You need to differentiate R-CHF from other causes of, say, fluid in the chest or abdomen, so a full workup is usually needed.
What does that involve?
Key things are blood tests, a CBC and biochemistry profile, definitely a heartworm test, especially in areas where it's common, and analyzing any fluid you can get out from the chest via thoracentesis or the abdomen via abdominocentesis. Ultrasound of the chest and abdomen is often very helpful too.
And you mentioned the jugular veins earlier.
Yeah, that's a big clue. Seeing those distended neck veins in an animal that also have fluid in the chest or abdomen, that strongly suggests heart failure is the reason.
Okay. And what might the tests themselves show? Blood work? Imaging?
Blood work might show mild to moderate increases in liver enzymes. That's from the blood backing up into the liver. Sometimes kidney values might be affected too.
And imaging? X-rays?
Chest X-rays might show enlargement of the right side of the heart. Maybe a big vein called the caudal vena cava looks larger than normal. You might see the pleural effusion or signs of liver and spleen enlargement. And the ascites, especially in dogs.
What about ultrasound?
Echocardiography, ultrasound of the heart, is super useful. Lets you actually see the heart chambers, the valves, how well it's pumping. You can spot congenital defects, masses, pericardial effusion.
Very detailed.
Yeah. And abdominal ultrasound can confirm the ascites, show an enlarged liver with dilated veins inside it. Sometimes you can even see blood flow going the wrong way in those liver veins because of the backup.
So bloods, imaging, fluid analysis
Yeah.
builds the picture. Any other tests? ECG?
Yep. An ECG electrocardiogram records the heart's electrical activity. It can give clues.
Right, don't worry.
You might see small QRS complexes, the main electrical signals if there's a lot of fluid damping them down. With pericardial effusion, sometimes you see electrical alternans. The size of the complexes changes beat to beat.
Huh.
It might show patterns suggesting right heart enlargement or detect arrhythmias. But importantly, the ECG can also be totally normal, even with R-CHF.
Good to know. And the fluid analysis.
When you tap the abdomen, abdominocentesis, the fluid in R-CHF is usually a modified transudate. From the chest thoracentesis, it can be more variable. Transudate, modified transudate, even chylous, sort of milky in cats sometimes, usually transudate or modified transudate in dogs.
Okay. Anything else diagnostic?
You can measure central venous pressure, the pressure in a large vein. It's typically high in R-CHF.
Right. It really sounds like piecing together all these clues, history, exam, tests, to get the full diagnosis. What about pathological findings, say, after death?
Well, the specific findings in the heart obviously depend on what caused the R-CHF in the first place.
Makes sense.
But a common finding in chronic long-term cases is that enlarged liver with damage in the center of its little functional units, central lobular necrosis. That's a direct result of the chronic congestion.
Okay. So we've covered the what, the why, the signs, the diagnosis. Let's shift to management. How is R-CHF treated?
Well, the initial approach depends on how sick the animal is. Most can actually be managed as outpatients, at home.
But not always.
No, if they're really struggling to breathe or collapsed because of massive fluid buildup, they'll need hospitalization first to stabilize them.
Okay. What does the general care involve?
Supportive care often means removing that excess fluid periodically, thoracentesis for chest fluid, abdominocentesis for belly fluid,
Right.
especially if meds aren't working well enough or the fluid is causing breathing problems.
And lifestyle.
Yes, activity restriction is important, and dietary changes, moderate sodium restriction usually, maybe a more severe restriction for advanced cases.
What about the long-term outlook? What should owners expect?
Client education is so important here because usually R-CHF isn't curable.
Oh, right.
There are exceptions, like if it's caused by treatable heartworm disease or a manageable arrhythmia or hyperthyroidism you get under control, or maybe pericardial effusion that resolves, but generally, it's about management, not cure.
So symptoms might improve, but likely come back.
Exactly. Most patients improve with initial treatment, but recurrence of the signs is common over time. Owners need to be prepared for that.
Are there surgical options in some cases?
Yes, for specific things. Surgery or procedures like balloon valvuloplasty can treat certain congenital defects, pulmonic stenosis, for example.
Okay.
If pericardial effusion is causing tamponade, draining it, pericardiocentesis, or even removing part of the sac pericardectomy might be done. And for that severe form of heartworm, Caval syndrome, surgery to remove the worms is vital.
So targeted procedures for specific problems. But for most cases, are medications the main approach?
Absolutely. Medication is usually the cornerstone, but very important. Only start meds after you have a definite diagnosis of R-CHF.
Right. What kinds of drugs?
Diuretics are often first. Furosemide is common, makes them urinate out the excess fluid.
So water pills.
Basically, yes. Spironolactone is another diuretic often used with furosemide. It might have other benefits, too, based on human studies.
Okay, what else?
Vasodilators. Drugs like ACE inhibitors and olaparib, benazepril, they help relax blood vessels. Usable in certain causes like dilated cardiomyopathy or leaky valves.
Any others?
Sildenafil can be used if there's high blood pressure in the lungs, pulmonary hypertension.
So drugs for fluid, drugs for blood vessels.
Yeah.
What about drugs to help the heart muscle pump better?
Yes, that's where pimobendan comes in. It's a useful drug. It helps the heart contract more strongly and widens blood vessels, so it helps the pump and reduces its workload. Especially good if the muscle itself is weak.
Sounds helpful.
And there's digoxin. It can also help strengthen the contraction in cases of muscle failure, like DCM, and it's used for certain arrhythmias, like atrial fibrillation, sometimes added if other drugs aren't quite enough.
Are there things to watch out for with these meds? Side effects? Precautions?
Yeah, definitely. You have to be careful. Diuretics, for instance, aren't usually good if there's pericardial tamponade.
Okay.
Vasodilators need caution with tamponade too, or if there's a fixed blockage preventing blood getting out of the heart. ACE inhibitors and digoxin need care if there's kidney disease involved. And some conditions, like low oxygen or thyroid problems, can make digoxin riskier. Hyperthyroidism can make it less effective, so you need the full picture.
What if the standard drugs aren't controlling things well enough?
There are other strategies, sometimes using 3 different types of diuretics together, or switching furosemide to a stronger one called torsemide.
Okay.
If electrolytes like potassium or magnesium are low on blood tests, supplementation might be needed carefully, though, especially potassium with ACE inhibitors or spironolactone.
What about non-drug therapies?
Well, treating any underlying arrhythmias is key. And things like taurine supplementation can help certain cats with DCM and some dog breeds with DCM too. Carnitine might help some dogs, like cockers or boxers with DCM.
So it really sounds like ongoing management requires careful monitoring and tweaking the plan.
Absolutely essential. Regular checks are needed. Kidney function, electrolytes, hydration, breathing rate and effort, body weight, belly measurement in dogs.
And you adjust based on those.
Yes. If kidney values worsen, you might lower the diuretic dose. If they keep worsening and the animal's on an ACE inhibitor, you might lower that too or stop it. Same logic for digoxin dose if kidney function declines.
Oh.
Regular ECGs to watch for arrhythmias, sometimes checking digoxin blood levels. It's all about close follow-up.
And what are the potential bumps in the road? Complications?
Things like blood clots forming and going to the lungs, pulmonary thromboembolism, new or worsening arrhythmias, electrolyte imbalances, digoxin toxicity if the dose is too high, and kidney problems worsening, potentially leading to renal failure.
Okay. So finally, the prognosis.
Yeah.
What's the general outlook?
As we mentioned, it really depends on the underlying cause of the R-CHF. Some causes have a much better or worse prognosis than others.
Right. So let's wrap this up. If someone listening takes away one key thing about right-sided congestive heart failure, what should it be?
I'd say the core message is that it's complex, lots of different causes, signs, treatments, but it all boils down to that right heart not pumping effectively forwards.
And crucially, it's not just a heart problem in a vacuum.
Exactly. We saw how that failure has knock-on effects everywhere. The fluid backup, the poor delivery of oxygen, it impacts the whole body.
Which really underlines why getting that accurate diagnosis is so vital to guide the right treatment.
Precisely. Understanding the why and the how is key for managing it effectively long-term.
So as a final thought for you listening, consider how something seemingly localized, like a problem on just one side of the heart, can create such widespread effects. It really makes you think about how interconnected everything in the body truly is. Thanks for joining us for this deep dive.